Are anxiety disorders real? Yes and no. Stay with me. I'm a licensed trauma therapist, and I absolutely want to untangle a very complex thought with you guys. One of the things that I've realized is we've done a real disservice in the mental health language around disorders and labeling things. And I already have a series on the DSM and like the dark history, but what I want you to hear is we have a serious problem about labeling something and then no longer discovering what's precipitating the disorder. All right. So, for example, like in the medical field, most people, when they start vomiting, they're not just subscribing to this idea of like, I'm vomiting. That's it. Nothing else is going on. Most people will be like, oh, I'm vomiting. And behind that story is food poisoning. Or I'm vomiting. And behind that story is nausea because I drank last night. Right? If we all stopped and just said, weird, I'm vomiting, and I'm not going to ask the question why that symptom of vomiting is occurring in my body, then we're missing an entire story behind the symptom. And so what I think the DSM really screwed up around is anxiety is a symptom, folks. It's a symptom. So when we say generalized anxiety disorder, or when we say, skin picking disorder or excoriation or whatever, it's just the fancy term. When we think about all of these like little nuanced things that we say, show up because of anxiety, we're missing so much of the origin story. And yes, it's not always trauma. All right. So for some folks, you can have anxiety symptoms by, studying for the LSAT or something. You can have situational anxiety about, going on stage for a performance. Right. We can kind of understand that that's like the precipitating event. Yet what people aren't asking is, do you have a fear of being perceived? Okay. So we're like, oh, performance anxiety. That's just like, it's like the vomiting thing. Oh, it's performance anxiety. And I go, okay, but like, if we stop there, not that it's not real, like you're having anxiety, absolutely validate that. But if we stop there, we just label something without actually getting to that really deep, visceral wound that is inside of us that needs to be addressed. So when someone's like, oh, I have anxiety about going outdoors, or I have anxiety about safety, or I have anxiety about cleanliness. And I'm like, all right, well, let's explore you having control over your environment and feeling like it's destabilized if it's not clean. Let's talk about your fear of being perceived if you're struggling when you go and present at work. Okay, let's talk about the precipitating factor that's leading the anxiety to the point of debilitation. So when people say, oh, I have, performance anxiety, of course you do. I'm not saying that that's not real. If you have generalized anxiety, of course you do. I'm not saying that's not real. But what I seriously have been seeing is people just say they have this cluster of symptoms and that's where they stop. And it's heartbreaking to me because then they're like, oh, I guess I am anxiety. I guess I live with this anxiety for the rest of my freaking life. And I go, that's a barrier to healing. It's a barrier to healing. And yes, stuff like depression and different things. Yes, absolutely. There can be chemical imbalances. There can be thyroid problems. There can be things in your physical body. And that to me is even more tragic. When someone's like, I have depression. And then I go, okay, but are you depressed because you're impoverished? Are you depressed because your partner left you? Are you depressed because there's a chemical imbalance? Are you depressed because there's a thyroid issue? Like, when we just stop at the symptom, nobody gets to flipping heal. Nobody gets to heal. And that's where it's like, we're all sitting there feeling like, this is my story. And I go, yes, it's your story right now. And I'm going to validate the hell out of that. But what makes me so sad is that in the like clinical world, right? We're like, oh, yep, slap a diagnosis. And then it's like, people start identifying with the symptom. They're like, I am, in the physical analogy, I am a vomiter. I vomit. Okay. And I'm like, has anyone ever explained that the reason you vomit might be because like an allergy? Like, have you ever like correlated that? Like, has anyone sat down with you and like done a food log to try to see if like one of the reasons you have like massive nausea or vomiting is because there's like some food issue? No, I've just grown to accept that I have to take, anti-nausea medication. And I'm like, yes, take the medication. Nobody wants to be nauseous all the time. Please take the medication. But what makes me so sad is that like people aren't asking the question after or the precipitating factors before. And that's why I feel like we're in this clustering of people that are like, they say these things are who they are, and then they're just left with like a Band-Aid. And then they're wondering like, is there more to this story? Yes, for some people it's trauma. For some people it's physical. For some people it's the situation that they're in. Or maybe the fact that like right now our society feels like it's crumbling. And like to sit there and be like, oh, you have a disorder because you have a natural reaction to the society crumbling. I sit there and I go, this is a real disservice to people's empowerment. Because that's my role here is like, I want to empower you on your healing. But when we use this language as like definitive end game stops, it's like there's nothing beyond that story for some people. And if I'm going to talk to anyone, I'm looking right at you. You are so much more than the symptoms that have come from whatever's going on in your life, right? The traumas you endured, the imbalances in your body. Believe me, I've had 3 children and I felt like a different person every time I had a pregnancy. And now I know that was a chemical imbalance. And I don't have to identify that as who I am. So if this helps one person, I hope that you can feel seen and heard, and that you're so much more. You're so much more than just the symptoms. And you deserve to understand yourself beyond the symptoms. You deserve that.